81. How do early intervention services improve outcomes in autism spectrum disorder? A. By completely curing the disorder. B. By developing skills at a critical period of brain development. C. By eliminating all behaviors associated with ASD. D. By delaying therapy until necessary. Answer. B. By developing skills at a critical period of brain development. Rationale. Early intervention supports skill development during critical periods. It does not cure ASD. 82. Which factor is not associated with autism spectrum disorder? A. Advanced paternal age. B. Prenatal exposure to valproate. C. Postnatal infections. D. Family history of ASD. Answer. C. Postnatal infections. Rationale. Postnatal infections are not established risk factors, unlike advanced paternal age, A, or prenatal exposures, B. 83. Which of the following is a typical behavioral intervention for autism spectrum disorder? A. ABA, applied behavior analysis. B. Psychoanalysis. C. Hypnotherapy. D. Chiropractic adjustments. Answer. A. ABA, applied behavior analysis. Rationale. ABA is evidence-based and focuses on behavior modification in ASD. Psychoanalysis, B, and hypnotherapy, C, are not standard interventions. 84. What does the term stimming refer to in autism spectrum disorder? A. Aggressive behaviors. B. Repetitive self-soothing behaviors. C. Lack of motor skills. D. Social withdrawal. Answer. B. Repetitive self-soothing behaviors. Rationale. Stimming involves repetitive behaviors like hand flapping, which helps self-regulate. It is not aggressive behavior. A. 85. Which screening tool is often used to identify autism spectrum disorder in toddlers? A. PHQ-9. B. MCHAT. C. Beck Depression Inventory. D. MMSE. Answer. B. MCHAT. Rationale. The Modified Checklist for Autism in Toddlers, MCHAT, is a widely used screening tool. PHQ-9A is for depression. 86. Which of the following is an early sign of autism spectrum disorder? A. Responding to name at 6 months. B. Lack of pointing or gesturing by 12 months. C. Walking before 10 months. D. Excessive babbling. Answer. B. Lack of pointing or gesturing by 12 months. Rationale. Failure to point or gesture is a red flag for ASD. Responding to name, A, is normal development. 87. What is the purpose of a social story in autism spectrum disorder management? A. To teach academic skills. B. To promote social understanding and behavior. C. To replace speech therapy. D. To enhance fine motor skills. Answer. B. To promote social understanding and behavior. Rationale. Social stories help individuals with ASD understand social scenarios. They do not replace other therapies. C. 88. What is a common goal of occupational therapy for individuals with autism spectrum disorder? A. Improving cardiovascular fitness. B. Enhancing sensory integration. C. Increasing muscle mass. D. Preventing infections. Answer. B. Enhancing sensory integration. Rationale. Occupational therapy focuses on sensory integration and daily life skills. It is not aimed at fitness. A. 89. What is echolalia, a behavior sometimes observed in autism spectrum disorder? A. Difficulty understanding instructions. B. Repeating words or phrases spoken by others. C. Avoidance of eye contact. D. Inability to respond to sounds. Answer. B. Repeating words or phrases spoken by others. Rationale. Echolalia is the repetition of spoken words, common in ASD. Avoidance of eye contact, C, is another behavior, but not echolalia. 90. Which factor increases the risk of autism spectrum disorder? A. Low birth weight. B. Prenatal exposure to folic acid. C. History of premature menopause. D. High levels of physical activity during pregnancy. Answer. A. Low birth weight. Rationale. Low birth weight and preterm birth are risk factors for ASD. Folic acid, B, may reduce risk. 91. What type of language difficulty is commonly seen in autism spectrum disorder? A. Impaired understanding of metaphors and idioms. B. Fluent and expressive verbal communication. C. Excessive use of complex vocabulary. D. Perfect understanding of nonverbal cues. Answer: A. Impaired understanding of metaphors and idioms. Rationale: people with ASD often struggle with abstract language concepts. 92. Which of the following behaviors might suggest a child has autism spectrum disorder? A. Engaging in pretend play frequently. B. Preferring to play alone. C. Responding quickly to social cues. D. Maintaining consistent eye contact. Answer: B. Preferring to play alone. Rationale: children with ASD often prefer solitary play. Pretend play, A, is more common in typical development. 93. What role do parents play in the management of autism spectrum disorder? A. Avoiding involvement to encourage independence. B. Passive observation of interventions. C. Active participation in therapy and interventions. D. Solely disciplining the child. Answer: C. Active participation in therapy and interventions. Rationale: parents actively contribute to the success of interventions and therapy programs. 94. Which co-occurring condition is frequently observed in individuals with autism spectrum disorder? A. Tuberculosis. B. Anxiety disorders. C. Hyperthyroidism. D. Multiple sclerosis. Answer: B. Anxiety disorders. Rationale: anxiety is common in ASD, often requiring intervention. Other conditions listed are unrelated. 95. Why is early diagnosis of autism spectrum disorder important? A. To confirm developmental delays. B. To enable early interventions that improve outcomes. C. To eliminate the need for long-term support. D. To avoid therapeutic measures. Answer: B. To enable early interventions that improve outcomes. Rationale: early diagnosis allows timely intervention, optimizing development and skills. 96. What is the primary purpose of speech therapy for individuals with autism spectrum disorder? A. To improve motor coordination. B. To enhance social and communication skills. C. To treat sensory processing issues. D. To manage behavioral challenges. Answer: B. To enhance social and communication skills. Rationale: speech therapy aims to develop effective communication and social skills. It does not address motor coordination. A. 97. What does a lack of joint attention in young children indicate? A. Typical language development. B. A potential sign of autism spectrum disorder. C. Advanced problem-solving skills. D. Strong attachment to caregivers. Answer: B. A potential sign of autism spectrum disorder. Rationale: joint attention, such as following a gaze or pointing, is often absent in ASD and serves as an early indicator. 98. Which diet modification might some parents try to improve symptoms of autism spectrum disorder? A. Gluten-free and casein-free diet. B. High-fat, low-carb diet. C. Vegan diet. D. Low-protein diet. Answer: A. Gluten-free and casein-free diet. Rationale: some believe eliminating gluten and casein reduces symptoms, though evidence is limited. 99. How do sensory sensitivities manifest in individuals with autism spectrum disorder? A. It's complete indifference to sensory input. B. Hypersensitivity or hyposensitivity to stimuli. C. Preference for loud noises. D. Consistent sensory preferences. Answer: B. Hypersensitivity or hyposensitivity to stimuli. Rationale: sensory sensitivities in ASD include overreaction or underreaction to sensory inputs. 100. Which of the following is a hallmark of autism spectrum disorder? A. Delayed gross motor skills. B. Difficulty with social interaction. C. Rapid developmental milestones. D. Preference for group activities. Answer: B. Difficulty with social interaction. Rationale: social interaction challenges are a key feature of ASD. Delayed motor skills, A, are not universal in ASD. 101. What is the purpose of functional behavior analysis, FBA, in autism spectrum disorder? A, To determine the cause of challenging behaviors. B. To diagnose intellectual disabilities. C. To treat sensory issues. D. To assess language development. Answer. A. To determine the cause of challenging behaviors. Rationale. FBA identifies triggers and functions of behavior, helping guide interventions. 102. Which of the following interventions helps develop social skills in individuals with autism spectrum disorder? A. Pharmacotherapy. B. Social skills training groups. C. Physical therapy. D. Restricting peer interactions. Answer. B. Social skills training groups. Rationale. Social skills training fosters interaction and communication. Restricting interactions, D, is counterproductive. 103. What role do occupational therapists play in autism spectrum disorder management? A. Addressing fine motor delays and sensory integration issues. B. Prescribing medication. C. Treating co-occurring mental health conditions. D. Teaching advanced academic skills. Answer. A. Addressing fine motor delays and sensory integration issues. Rationale. Occupational therapists focus on improving daily functioning and sensory processing. 104. What is the role of the DSM-5 in autism spectrum disorder? A. It provides guidelines for treatment. B. It offers diagnostic criteria for ASD. C. It prescribes therapeutic interventions. D. It classifies educational needs. Answer. B. It offers diagnostic criteria for ASD. Rationale. The DSM-5 standardizes diagnosis through criteria for ASD. Treatment guidelines are developed separately. 105. What is the primary function of early intervention services in autism spectrum disorder? A. To delay diagnosis. B. To provide therapies that support development. C. To eliminate the need for future services. D. To assess parenting skills. Answer. B. To provide therapies that support development. Rationale. Early intervention enhances development through tailored therapies. It does not delay diagnosis. A. 106. Which of the following best describes the restricted interests seen in autism spectrum disorder? A. Lack of interest in hobbies. B. Focused and intense interest in specific topics. C. Excessive interest in social interactions. D. Lack of any interests. Answer. B. Focused and intense interest in specific topics. Rationale. Individuals with ASD often display intense interest in niche subjects, a hallmark feature. 107. How might a pediatrician screen for autism spectrum disorder in a 2-year-old child? A. Conducting a complete neurological exam. B. Using the MCHAT questionnaire. C. Ordering a brain MRI. D. Testing for genetic disorders. Answer. B. Using the MCHAT questionnaire. Rationale. The MCHAT is a validated screening tool for ASD in toddlers. Genetic testing, D, is less commonly used initially. 108. Which of the following is an appropriate goal for individuals with autism spectrum disorder in a therapeutic setting? A. Complete independence in all activities. B. Maximizing individual potential and quality of life. C. Avoidance of social interactions. D. Elimination of all repetitive behaviors. Answer. B. Maximizing individual potential and quality of life. Rationale. Goals focus on improving quality of life rather than achieving unrealistic outcomes like total independence. A. 109. What does the term perseverative behavior refer to in autism spectrum disorder? A. Difficulty transitioning from one activity to another. B. Continuous repetition of a particular action or phrase. C. Excessive engagement in team activities. D. Indifference to routine changes. Answer. B. Continuous repetition of a particular action or phrase. Rationale. Perseverative behaviors are repetitive and often serve a self-regulating purpose in ASD. 110. Which of the following is commonly associated with autism spectrum disorder? A. Increased verbal fluency. B. A strong preference for routine and predictability. C's inability to read. D. Excessive social interactions. Answer. B. Strong preference for routine and predictability. Rationale. Individuals with ASD often exhibit a preference for routines and can become distressed when disrupted. 111. Which of the following treatments is considered most effective for children with autism spectrum disorder? A. Medication alone. B. Behavior therapy, such as applied behavior analysis, ABA. C. Social interaction without any structured intervention. D. Sensory deprivation. Answer: B. Behavior therapy, such as applied behavior analysis, ABA. Rationale: ABA is widely recognized as an effective evidence-based therapy for children with ASD. 112. What is a common challenge for individuals with autism spectrum disorder in a social context? A. Lack of interest in physical activity. B. Difficulty interpreting nonverbal cues such as facial expressions. C. Over-reliance on verbal communication. D. Difficulty with fine motor coordination. Answer: B. Difficulty interpreting nonverbal cues such as facial expressions. Rationale: social communication deficits, including difficulty understanding nonverbal cues, are central to ASD. 113. What is a primary symptom that characterizes the restricted and repetitive behaviors in autism spectrum disorder? A. Difficulty in learning new tasks. B. Engaging in the same actions or phrases repetitively. C. Lack of interest in sensory experiences. D. A preference for group discussions. Answer: B. Engaging in the same actions or phrases repetitively. Rationale: restricted and repetitive behaviors are hallmark features of ASD, often involving repetitive actions or phrases. 114. Which intervention is commonly used to help manage sensory processing difficulties in individuals with autism spectrum disorder? A. Occupational therapy and sensory integration therapy. B. Surgical intervention. C. Group therapy. D. Medication alone. Answer: A. Occupational therapy and sensory integration therapy. Rationale: sensory integration therapy is used to address sensory sensitivities that are common in ASD. 115. What is a key diagnostic criterion for autism spectrum disorder according to the DSM-5? A. Presence of significant cognitive impairment. B. Impaired social communication and interaction across multiple contexts. C. Preference for solitary activities. D. Delayed speech development only. Answer: B. Impaired social communication and interaction across multiple contexts. Rationale: the DSM-5 emphasizes deficits in social communication and interaction, a core feature of ASD. 116. What is the significance of early diagnosis and intervention in autism spectrum disorder? A. It guarantees full recovery. B. It may improve long-term outcomes and development. C. It only affects academic outcomes. D. It has no impact on future development. Answer: B. It may improve long-term outcomes and development. Rationale: early intervention can significantly improve developmental and behavioral outcomes for children with ASD. 117. Which of the following is a common co-occurring condition in individuals with autism spectrum disorder? A. Asthma. B. Schizophrenia. C. ADHD. D. Diabetes. Answer: C. ADHD. Rationale: ADHD is commonly co-occurring with ASD, affecting attention, focus, and behavior. 118. What is the most important goal of behavioral therapy for children with autism spectrum disorder? A. To increase academic skills. B. To improve social and communication skills. C. To teach independent living skills. D. To reduce the need for family involvement. Answer: B. To improve social and communication skills. Rationale: improving social and communication skills is the main goal of many behavioral interventions in ASD. 119. Which is the most likely reason why some individuals with autism spectrum disorder engage in repetitive behaviors? A. A form of self-soothing or self-regulation. B. A desire to manipulate others. C. A sign of mental illness. D. A lack of physical activity. Answer: A form of self-soothing or self-regulation. Rationale: repetitive behaviors often serve as a means of coping with sensory overload or anxiety. 120. Which is a characteristic of the social communication challenges seen in autism spectrum disorder? A. Excessive eye contact. B. Difficulty understanding jokes or sarcasm. C. Overly engaging in conversation. D. Enhanced ability to understand nonverbal cues. Answer. B. Difficulty understanding jokes or sarcasm. Rationale. Difficulty understanding abstract or non-literal language, such as sarcasm or jokes, is common in ASD. 121. Which of the following is a potential early sign of autism spectrum disorder in infants or toddlers? A. Playing pretend games with others. B. Limited eye contact or social smiling. C. Consistent joint attention. D. Advanced language development. Answer. B. Limited eye contact or social smiling. Rationale. Early signs of ASD include a lack of typical social behaviors like eye contact and social smiling. 122. Which of the following might be considered a strength of individuals with autism spectrum disorder? A. Difficulty completing tasks independently. B. Exceptional attention to detail. C. Frequent challenges with routine changes. D. Limited ability to solve problems. Answer. B. Exceptional attention to detail. Rationale. Many individuals with ASD have strong attention to detail and can excel in tasks requiring focus and precision. 123. Which of the following is a potential complication associated with autism spectrum disorder? A. Intellectual disability. B. Asthma. C. Hypertension. D. Cancer. Answer. A. Intellectual disability. Rationale. Some individuals with ASD may also have an intellectual disability, though not all. 124. What is one of the primary goals of social skills training for individuals with autism spectrum disorder? A. To teach academic skills. B. To enhance the ability to interact with peers and adults. C. To decrease repetitive behaviors. D. To increase independence in daily living tasks. Answer. B. To enhance the ability to interact with peers and adults. Rationale. Social skills training focuses on improving communication and interaction with others. 125. Which therapeutic approach is used to address behavior management in individuals with autism spectrum disorder? A. Dialectical behavioral therapy. B. Applied behavior analysis, ABA. C. Cognitive behavioral therapy, CBT. D. Psychoanalysis. Answer. B. Applied behavior analysis, ABA. Rationale. ABA is a widely used therapy to address and modify challenging behaviors in ASD. 126. What is the significance of the theory of mind in understanding autism spectrum disorder? A. It refers to the ability to understand and attribute mental states to oneself and others. B. It is related to sensory processing. C. It describes the ability to read and write effectively. D. It is a strategy for behavior modification. Answer. AIM. It refers to the ability to understand and attribute mental states to oneself and others. Rationale. Theory of mind is a concept often impaired in ASD, affecting empathy and social understanding. 127. Which of the following is often a challenge for caregivers of children with autism spectrum disorder? A. Managing hyperactivity. B. Limited social communication and social engagement. C. Lack of structure and routine. D. Excessive verbal communication. Answer. B. Limited social communication and social engagement. Rationale. Caregivers often struggle with limited communication and engagement, which are core features of ASD. 128. What is the role of the Autism Diagnostic Observation Schedule, ADOS, in diagnosing autism spectrum disorder? A. It is used to assess intellectual abilities. B. It is a direct observational assessment used to diagnose ASD. C. It prescribes pharmacological treatment. D. It measures the severity of sensory processing issues. Answer. B. It is a direct observational assessment used to diagnose ASD. Rationale. The ADOS is a standardized observational tool for diagnosing ASD. 129. Which is a common misconception about autism spectrum disorder? A. All individuals with ASD have intellectual disabilities. B. Early intervention can improve outcomes. C. Some individuals with ASD may have normal or above-average intelligence. D. ASD is not caused by environmental factors. Answer. A. All individuals with ASD have intellectual disabilities. Rationale. Not all individuals with ASD have intellectual disabilities. Many have average or above-average intelligence. 130. What is the focus of the TACCH program for individuals with Autism Spectrum Disorder? A. Academic achievement. B. Structured teaching environments to promote independence. C. Sensory processing techniques. D. Medication management. Answer: B. Structured teaching environments to promote independence. Rationale: the TACCH program emphasizes structured environments and visual supports to increase independence. 131. Which of the following is a common co-occurring condition with autism spectrum disorder? A. Hypertension. B. Down syndrome. C. Anxiety disorders. D. Asthma. Answer: C. Anxiety disorders. Rationale: anxiety disorders frequently co-occur with ASD, affecting emotional regulation and daily functioning. 132. What is the typical developmental trajectory for language skills in children with autism spectrum disorder? A. Rapid development of verbal skills. B. Delayed language development with some children remaining nonverbal. C. Early advanced language skills. D. No language development at all. Answer: B. Delayed language development with some children remaining nonverbal. Rationale: many children with ASD experience delayed language development, and some may remain nonverbal throughout life. 133. Which therapeutic approach emphasizes using structured routines and visual supports for children with autism spectrum disorder? A. Cognitive behavioral therapy, CBT. B. Sensory integration therapy. C. TACCH program. D. Dialectical behavioral therapy. Answer: C. TACCH program. Rationale: the TACCH program uses structured teaching environments and visual supports to aid children with ASD. 134. What is the significance of the early signs of autism spectrum disorder, such as delayed language development and lack of social engagement? A. They often go unnoticed until later childhood. B. They help differentiate ASD from other developmental disorders. C. They have no impact on the diagnosis. D. They are not present in most cases of ASD. Answer: B. They help differentiate ASD from other developmental disorders. Rationale: early signs are crucial for distinguishing ASD from other developmental disorders, enabling earlier intervention. 135. Which of the following is true about the genetic factors associated with autism spectrum disorder? A. ASD is solely caused by genetic mutations. B. Environmental factors play no role in the development of ASD. C. There is a higher likelihood of ASD in siblings of affected individuals. D. ASD is only seen in families with a history of intellectual disabilities. Answer: C. There is a higher likelihood of ASD in siblings of affected individuals. Rationale: genetic factors increase the likelihood of ASD in siblings of affected children, although environmental factors can also contribute. 136. Which of the following is a primary goal of occupational therapy for individuals with autism spectrum disorder? A. To improve academic skills. B. To enhance sensory integration and daily living skills. C. To prescribe medication. D. To reduce physical activity. Answer: B. To enhance sensory integration and daily living skills. Rationale: occupational therapy focuses on improving sensory integration and developing functional skills for daily life. 137. In which stage of life is autism spectrum disorder most commonly identified? A. Adolescence. B. Preschool or early childhood. C. Early adulthood. D. Late adulthood. Answer: B. Preschool or early childhood. Rationale: ASD is most commonly identified in early childhood, typically by the age of 3 when developmental delays become noticeable. 138. What is the role of speech-language therapy in the treatment of children with autism spectrum disorder? A. To improve memory and attention. B. To address communication deficits, including speech and social language. C. To focus on academic achievement. D. To manage physical coordination issues. Answer: B. To address communication deficits, including speech and social language. Rationale: speech-language therapy helps children with ASD improve communication, including both verbal and social language skills. 139. Which of the following is a key symptom of autism spectrum disorder related to social communication? A. Constant need for stimulation. B. difficulty making and maintaining friendships. C. Ability to understand abstract language. D. Overexcitement in social interactions. Answer. B. Difficulty making and maintaining friendships. Rationale. Difficulty with social interaction, including forming and maintaining friendships, is a hallmark of ASD. 140. What is the primary purpose of a functional behavior assessment, FBA, for individuals with autism spectrum disorder? A. To prescribe medications for behavior management. B. To understand the causes of problematic behaviors and develop interventions. C. To diagnose the presence of ASD. To assess intellectual functioning. Answer. B. To understand the causes of problematic behaviors and develop interventions. Rationale. The FBA helps identify the triggers for challenging behaviors and informs intervention strategies. 141. Which of the following best describes the cognitive abilities of individuals with autism spectrum disorder? A. They are typically impaired in all areas of cognition. B. Cognitive abilities vary widely, with some individuals having average or above-average intelligence. C. All individuals with ASD have severe cognitive impairment. D. Cognitive abilities are not relevant to the diagnosis of ASD. Answer. B's. Cognitive abilities vary widely, with some individuals having average or above-average intelligence. Rationale. Cognitive abilities in individuals with ASD range from intellectual disabilities to average or above-average intelligence. 142. What is a common misconception about individuals with autism spectrum disorder regarding empathy? A. They have no capacity for empathy. B. They have intense empathy but struggle with social communication. C. They experience empathy in a typical manner but avoid social interactions. D. They lack the ability to recognize emotions in others. Answer. B. They have intense empathy but struggle with social communication. Rationale. Many individuals with ASD experience empathy, but may have difficulty expressing it due to social communication challenges. 143. Which of the following is a characteristic behavior in individuals with autism spectrum disorder? A. Spontaneous social engagement with strangers. B. Strong interest in specific, often narrow, topics or activities. C. Frequent participation in group activities. D. Ability to tolerate changes in routine without distress. Answer. B. Strong interest in specific, often narrow, topics or activities. Rationale. Restricted and repetitive behaviors often manifest as intense interest in specific topics or activities. 144. How do sensory sensitivities affect individuals with autism spectrum disorder? A. They have a heightened tolerance for pain and discomfort. B. They may become overwhelmed by certain sensory stimuli, such as lights or sounds. C. Sensory sensitivities are rare in individuals with ASD. D. Sensory processing is not typically impacted in ASD. Answer. B. They may become overwhelmed by certain sensory stimuli, such as lights or sounds. Rationale. Many individuals with ASD have heightened sensory sensitivities, leading to discomfort or distress in response to sensory stimuli. 145. Which of the following is a common strength observed in some individuals with autism spectrum disorder? A. Difficulty with routine activities. B. Exceptional memory or attention to detail. C. Difficulty recognizing patterns. D. Lack of interest in visual arts. Answer. B. Exceptional memory or attention to detail. Rationale. Many individuals with ASD demonstrate strong attention to detail or have excellent memory skills. 146. Which of the following is a potential benefit of early intervention for children with autism spectrum disorder? A. It guarantees that the child will be fully integrated into mainstream classrooms. B. It can improve language skills and reduce behavioral challenges. C. It eliminates the need for ongoing therapy. D. It has no long-term effect on the child's development. Answer. B. It can improve language skills and reduce behavioral challenges. Rationale. Early intervention can significantly improve developmental skills, including language and behavior management. 147. Which of the following is a treatment approach that focuses on helping children with autism spectrum disorder engage in more meaningful social interactions? A. Cognitive behavioral therapy, CBT. B. Social skills training. C. Electroconvulsive therapy, ECT. D. Psychodynamic therapy. Answer. B. Social skills training rationale. Social skills training helps children with ASD improve their ability to interact and communicate with others in social settings. 148. What is one of the key goals of sensory integration therapy for individuals with autism spectrum disorder? A. To increase the amount of physical activity. B. To improve the ability to process and respond to sensory input. C. To develop more structured daily routines. D. To enhance verbal communication skills. Answer. B. To improve the ability to process and respond to sensory input. Rationale. Sensory integration therapy helps individuals with ASD cope with sensory sensitivities and process sensory input more effectively. 149. Which of the following is a common feature of intellectual disability in individuals with autism spectrum disorder? A. Impaired verbal communication only. B. Difficulty with abstract thinking and problem-solving. C. Lack of interest in learning activities. D. Excessive social interaction. Answer. B. Difficulty with abstract thinking and problem-solving. Rationale. Intellectual disability in ASD often involves difficulty with abstract thinking, problem-solving, and cognitive flexibility. 150. What is the purpose of the Childhood Autism Rating Scale, CARS? A. To assess cognitive abilities. B. To measure the severity of autism symptoms. C. To evaluate social engagement. D. To diagnose intellectual disabilities. Answer. B. To measure the severity of autism symptoms. Rationale. The CARS is used to assess the severity of autism symptoms across various domains, helping guide treatment planning. 151. Which of the following is a primary characteristic of autism spectrum disorder? A. High academic achievement. B. Deficits in social communication and interaction. C. Exceptional physical coordination. D. Strong verbal language skills. Answer. B. Deficits in social communication and interaction. Rationale. A core feature of ASD is deficits in social communication and interaction, which can manifest as difficulty with eye contact, social cues, and forming relationships. 152. What is the role of applied behavior analysis, ABA, in treating children with autism spectrum disorder? A. To reduce aggression through medication. B. To modify specific behaviors using reinforcement strategies. C. To provide a cure for autism. D. To focus exclusively on academic skills. Answer. B. To modify specific behaviors using reinforcement strategies. Rationale. ABA is a therapeutic technique that uses reinforcement strategies to encourage positive behaviors and reduce problematic ones. 153. Which of the following is a common sensory issue seen in individuals with autism spectrum disorder? A. Insensitivity to loud noises. B. Overreaction to sensory stimuli like lights and sounds. C. Lack of sensory processing altogether. D. Strong preference for silence. Answer. B. Overreaction to sensory stimuli like lights and sounds. Rationale. Many individuals with ASD experience heightened sensitivity to sensory stimuli such as bright lights, loud sounds, and certain textures. 154. Which of the following is an evidence-based intervention used for improving social communication in children with autism spectrum disorder? A. Medication therapy. B. Social skills training. C. Physical therapy. D. Art therapy. Answer. B. Social skills training. Rationale. Social skills training is an evidence-based intervention that helps children with ASD develop better social communication and interaction abilities. 155. What role do genetics play in the development of autism spectrum disorder? A. There is no genetic link to ASD. B. Genetic factors increase the likelihood of developing ASD, but are not the sole cause. C. ASD is caused entirely by genetic mutations. D. Genetic factors have no impact on ASD outcomes. Answer. B. Genetic factors increase the likelihood of developing ASD, but are not the sole cause. Rationale. While genetics can increase the likelihood of ASD, environmental factors and prenatal influences also play a role. 156. How does the DSM-5 categorize autism spectrum disorder? A. As a mood disorder. B. As a neurodevelopmental disorder. C. As a personality disorder. D. As a psychotic disorder. Answer. B. As a neurodevelopmental disorder. Rationale. The DSM-5 classifies ASD as a neurodevelopmental disorder characterized by developmental deficits in social communication and restricted patterns of behavior. 157. Which of the following is a typical characteristic of the restricted interests seen in children with autism spectrum disorder? A. Broad, flexible range of topics. B. Intense focus on specific topics or activities. C. Disinterest in any particular subject. D. Curiosity about all subjects. Answer. B's intense focus on specific topics or activities. Rationale. Children with ASD often have intense, narrow interests in specific topics or activities, which they may pursue with great passion. 158. What is the primary goal of early intervention for children with autism spectrum disorder? A. To cure autism completely. B. To improve functional skills such as communication and social interaction. C. To ensure academic achievement in a typical classroom. D. To limit physical activity and sensory stimulation. Answer. B. To improve functional skills such as communication and social interactions. Rationale. Early intervention aims to improve communication, social skills, and behavior management, leading to better outcomes for children with ASD. 159. Which of the following is commonly used in the assessment of autism spectrum disorder? A. MRI scans. B. Childhood Autism Rating Scale, CARS. C. Blood tests. D. X-rays. Answer. B. Childhood Autism Rating Scale, CARS. Rationale. The CARS is commonly used to assess the severity of autism symptoms and help guide treatment and interventions. 160. Which of the following is not typically recommended as a treatment for autism spectrum disorder? A. Applied behavior analysis, ABA. B. Medication to address co-occurring conditions. C. Electroconvulsive therapy, ECT. D. Speech-language therapy. Answer. C's electroconvulsive therapy, ECT. Rationale. Electroconvulsive therapy, ECT, is not used for treating ASD. More common treatments include ABA, speech therapy, and medication for co-occurring conditions.